Hi students, in this video we will discuss the different types of chemicals which are commonly used as disinfectant or antiseptic. First, alcohols. Three types of alcohols are commonly used. One is ethyl alcohol, commonly called ethanol, and second one is isopropyl alcohol, and the third one, which is less used one, that is methanol. So the most frequently used alcohols are ethyl alcohol and isopropyl alcohol. These two alcohols are most commonly used as skin antiseptic or skin disinfectant. Among this, ethanol is the most commonly used one. Now we can see the presence of this ethanol, that is 70% or more than that, in all types of sanitizers. We are commonly using this as a sanitizer or skin antiseptic. And this particular ethanol kills a bacteria by denaturing their proteins. We have in the previous class we have discussed different modes of action of these types of chemicals. Here the alcohols, mainly ethanol, kill a bacteria by denaturing their proteins. And both these type of alcohols are effective only against vegetative cells, not on spores. That's why these are only disinfectants or antiseptics, not as a sterilizing agent. And these two alcohols are more effective at 60 to 70% concentration, not at 95 or 100% concentration, because the presence of a little amount of water will enhance the antimicrobial action of these two alcohols. Compared to ethanol, isopropyl alcohol is more efficient than this because it is a better fat solvent, then having more bacterial activity and also less volatile. It is used for disinfection of clinical thermometers. Then the third one, methyl alcohol, is effective against fungal spores and is commonly used for cleaning cabinets and incubators, not on live tissues or on skin. Methyl alcohol is, its vapor itself is highly toxic, and this methyl alcohol is highly inflammable than the other two. The second type of chemical which is used for disinfection is aldehydes. The aldehydes are commonly used as disinfectant, not as antiseptics. Two types of aldehydes are used, formaldehyde and glutaraldehyde. First we will discuss on formaldehyde. Formaldehyde is used in two forms, that is aqueous form and gaseous form. In aqueous solution, formaldehyde is highly bactericidal and acts upon proteins. Bactericidal means they can kill bacteria, and they kill the bacteria by denaturing or by acting upon proteins, means denaturing proteins. And it is commonly used to preserve anatomical specimens and for destroying anthrax spores and cleaning metal instruments. Formaldehyde gas is also used for sterilization of instruments and fumigation of wards and labs. Furniture, beds, clothing, books can be effectively disinfected by using formaldehyde gas. So it is most commonly used gas for fumigation purpose. Fumigation means the fumigation for the large areas or the closed areas where we cannot use the normal method of sterilization. In that case we are using gas. The gas which is used for this purpose is formaldehyde gas. And there are negatives for this gas. The gas is irritant and also it is toxic when inhaled. And the irritant or the smell can be neutralized by ammonium vapors after disinfection. After disinfection, but the toxic or the irritant smell can be neutralized by using by generating ammonium vapors. Then second type of aldehyde is glutaraldehyde. Glutaraldehyde is mainly used for cleaning cement surfaces, lenses of microscopes and other instruments. And this particular glutaraldehyde has a similar action, that is they kill the bacteria, it kills the bacteria by acting upon proteins. Then this bacteria, this particular glutaraldehyde is specifically effective against tuberculosis bacilli, that is Mycobacterium tuberculosis, and also it is effective against fungi and viruses. And compared to the formaldehyde, it is less toxic and less irritant. Third type of chemical which is commonly used is the phenol. Phenol was the first widely used antiseptic and disinfectant. This is the first identified antiseptic and disinfectant. It was in 1867 by Joseph Lister. He employed it to reduce the risk of infection during operation. Joseph Lister, he was a surgeon. So to prevent the infection during surgery, he used this phenol to clean the operating instruments like scissors or blades, and also the area, the operating area is cleaned by applying phenols. So because of his contribution or introduction of this phenol as a disinfectant and antiseptic first time, he is known as the father of antiseptic surgery. Phenols are obtained by distillation of coal tar. The lethal effect of phenol is due to their capacity to cause cell wall damage. Unlike the alcohols and aldehydes, phenols causes the cell damage by causing cell wall damage of bacterium. They mainly act upon cell wall. The low concentrations of phenol can precipitate proteins. They can cause denaturation of proteins also at lower concentrations. They are widely used for disinfecting hospitals. It is a general disinfectant used mainly in hospital and such areas. The two forms, the Lysol and Cresol, these are the two important forms, Lysol and Cresol, are effective against wide range of organisms. They are not readily inactivated by the presence of organic matter. That is the one important good character of this phenol. These are toxic to humans. The other form, chlorophenols and chloroxyphenols, are widely used as general disinfectant because they are less toxic and less irritant. The less toxic forms of phenols are chlorophenols and chloroxyphenols. Although less active, they are more readily inactivated. The other important phenol-based skin antiseptic is chlorhexidine. Chlorhexidine is a relatively non-toxic skin antiseptic. It is more active against gram-positive bacteria. So in this video, we discussed only 3 types of chemicals: alcohols, aldehydes and phenols. Thank you.